Good evening and welcome to Reproaction's Act and Learn webinar for June 2019. We're very excited about tonight's topic, diaper banks and menstrual product banks. Hygiene is a reproductive justice issue. So first we'll start with an introduction of your hosts, who are the co-founders and co-directors of Reproaction. The first voice you hear is myself, Erin Matson. I use she, her pronouns. I'm proudly based in Arlington, Virginia, and I'm Erin to the max on Twitter. Pamela. Oh, Pamela, you are muted. Let me see. Pamela, are you there?
I am. I am so sorry. So I am the other co-founder and co-director of Reproaction, Pamela Merritt, and I'm based in St. Louis, Missouri.
Great. Okay, so go ahead.
Okay, thank you. So our agenda for tonight is going to be a quick introduction of Reproaction, and then I'm going to give a quick intro of the topic, which is that hygiene is a reproductive justice issue. And then we're going to have an awesome panel discussion featuring Jessica Adams, who is the founder and executive director of the St. Louis Area Diaper Bank, and Paula Canny, who is a criminal defense lawyer based in California. And then hopefully Lori Bertram Roberts will be able to join us. She is the co-founder and executive director of the Mississippi Reproductive Freedom Fund. After that, we'll go through some next steps, and then we may have time for a Q&A after all of that awesome content. The hashtag for live tweeting is Reproaction. So Reproaction, founded in July of 2015, we lead bold, direct action to increase access to abortion and advance reproductive justice. We have a out loud and proud left flank analysis. We are incredibly proud of our willingness to hold folks on all sides accountable, whether they identify as allies or the opposition, and we are committed to nonviolent direct action. So just to introduce the topic, and I'm so excited that we're going to be able to have this discussion tonight, I wanted to talk about kind of how I came up with this idea for a webinar. Obviously, access to menstrual hygiene products and diapers is a reproductive justice issue. But that's obvious to me. It might not be obvious to other people. And they also might not be aware that for people who are incarcerated, accessing these products is extremely difficult and ridiculously expensive. When I first moved back home to St. Louis, Missouri in 2003, I started volunteering at local transitional housing shelters for women. And one of the things that constantly came up with the women that I worked with was the fact that they were struggling to afford the basic essential needs for their children. And they were trying to balance that with housing issues and transportation, and how incredibly demoralizing it was, and in certain instances humiliating, to not be able to ensure that the child would have a clean diaper, or that they themselves would be able to go to work because they couldn't afford tampons or pads. So this is an issue that was first really brought into sharp relief for me doing that work. But now, as more and more people struggle to make ends meet and struggle to access basic health care, this is a struggle that needs to be lifted up as a critical reproductive justice issue. So I am extremely proud to be, for us to be presenting this webinar tonight. And I hope that everybody will get a lot of interesting and cool ideas from our panelists. Handing it over to you, Erin.
Great, thank you. Pamela, do you have Jessica on your line?
I sure do.
Okay, great. Then I am very pleased to introduce Jessica Adams, the founder and executive director of the St. Louis Area Diaper Bank. Jessica started the organization at her kitchen table in the spring of 2014. Her desire to start a diaper bank in St. Louis grew after she learned about the work the National Diaper Bank Network was doing to alleviate the diaper need experienced by 1 in 3 mothers across the country. Hundreds of thousands of women who routinely lack the diapers they need to keep their children clean and dry. Jessica's real passion for this work, however, grew out of her own experience of living in poverty as a single mom of 4. In those days, Jessica struggled to provide everything her children needed, but the most horrifying and humiliating experience was knowing that she couldn't purchase the diapers that her youngest child needed. Jessica knew that she needed to do something to ensure that other mothers wouldn't have to struggle the way she did. Since founding, the St. Louis Area Diaper Bank has helped change more than 2 million diapers for more than 60,000 children in the St. Louis metro. The St. Louis Alliance for Period Supplies is a new initiative of the St. Louis Area Diaper Bank. Jessica, you are a hero. Thank you so much for joining us tonight.
Well, thank you so much for having me. I think the hero term is definitely overrated, but thank you. That makes me feel good about myself, and I'm really happy to be with everybody tonight. Thank you so much.
Yep, well, it's earned in your case, so, and we'll just let you showcase your work. So my first question for you, if you could tell us more about the origin story for the St. Louis Area Diaper Bank. It's in your bio, but just to dig in a little bit deeper, how did you take it from concept to reality, and what is the population you serve?
Sure. So the bio definitely said a lot, and honestly, it was probably a combination of my go-get-em attitude and also naivete about what it means to actually run a nonprofit organization that led me to go ahead and start it. But, I heard a story on NPR about the fact that 1 in 3 moms routinely experiences diaper need, and that felt like an awful lot to me. I was surprised by that number, and it was especially surprising to me because, when I was experiencing diaper need, like the first time I ever went to a food pantry, I asked if they had diapers, and the lady had looked at me like I was absolutely crazy. And I felt like, places like food pantries and other institutions that are around to help people in need, if they don't have diapers, that probably good moms could figure out a way to get diapers. And so I was convinced that experience of diaper need for me personally had been like really a personal failing, and that if there wasn't a system designed to meet that need, that there must not really be that big of a need. So I was astounded to hear that 1 in 3 moms routinely experience diaper need. And I also heard the executive director of the National Diaper Bank Network saying that at that time, this was 2013, almost every major city in the country had a diaper bank. And I was like, okay, cool. St. Louis is a major city. So I'm like Googling around to find a diaper bank and get involved, and there wasn't one. So I had just finished a master's in social work, and I was like, I'm totally qualified to start a nonprofit, which is funny now looking back. So I just decided that it was a need that wasn't being met in St. Louis. I felt uniquely qualified, given my personal experiences, to try to meet that need. And so I just kind of forged ahead, which is why I hesitate to accept that hero moniker, because I think, I don't know, how many people do we all know who just do amazing things because they're just putting one foot in front of the other, just trying to do something that matters to them. So, and then really taking it from concept to reality was nothing really that I did, but the fact that when other people learned about diaper need, they felt the same way I did. A, I had no idea that is a thing that existed, and B, that's horrifying. And I cannot believe that people in our own city experience this need. And I think all along throughout the diaper bank's history, people have been really motivated to join the cause because it's just so shocking that this is a need that exists.
Yeah, so just on that point of the shocking, I think one of the things that is commonly assumed is that diapers are covered through public programs to help people who are struggling, programs like SNAP, Medicaid, and Women's Infant and Children, or WIC. Can you explain why those programs don't address diaper need?
Sure. So SNAP and WIC are primarily nutrition assistance programs, and so they aim to meet the nutritional needs of low-income families, and that's really the way that we want to keep those programs. However, I will say my husband is used to be a child advocate, and when I told him that WIC didn't cover diapers, he was like, yeah, no, it totally does. I was like, no, it actually doesn't. He's like, wait, what? So, I mean, I think it's a common misconception that WIC must cover diapers. A program called Women, Infants, and Children must provide for this clearly critical and basic need of diapers, but it does not, because it's just for nutrition. So Medicaid is a more difficult question to answer, right? Like, Medicaid is a program that provides for the health needs of low-income families and children, and clearly, obviously, clean diapers are connected to a child's health in so many different ways. So in terms of why doesn't Medicaid cover diapers, I mean, this is a little snarky, but in Missouri, Medicaid barely covers anyone or anything. So I feel like that's kind of an explanation. But I mean, diapers are expensive, and that's why it's hard for families to afford them. And I think that is the hesitation of governments through their social safety net programs to cover diapers, because they're expensive.
So tragic that this need exists at all. And I want to ask just a follow-up question about the St. Louis Metro specifically and the population you serve. What is the diaper need in the St. Louis Metro, and how do you measure that?
So we really look to census statistics. I mean, it's difficult to find out exactly, how many children are wearing diapers in St. Louis whose families don't have the resources to get those diapers for them. So what we're looking at is, the American Community Survey data for families living in poverty with children under 5. So those are families that we say either are experiencing diaper need now or have experienced diaper need in the very recent past. In some zip codes in the St. Louis region, the families living in poverty it's more than 60, 70, 80% of people in certain zip codes in the St. Louis region. The poverty in certain areas in St. Louis is absolutely shocking.
All right, let's shift gears a little bit. I'm just curious, kind of on a day-to-day level, what are the logistics of getting diapers and giving diapers?
Sure. So we get diapers from several sources. Yesterday, we got a semi-truckload of 225,000 diapers from Huggies, which is a national sponsor of the National Diaper Bank network. So those diapers came to us just donated, which is awesome. We also collect diapers from individuals in the St. Louis region who have diaper drives at their homes, their businesses, their churches, their community groups, whatever. And we also collect funds and actually purchase a large portion of our diapers. So if anybody takes a diaper to Target, you can takes a dollar to Target, you can buy 4 diapers with that. But if you give $1 to the diaper bank, we can buy anywhere between 8 and 50 diapers with that $1, depending on what's available to us at that time. So dollars definitely go further with us than at the store. So we have diapers donated. We purchase diapers through wholesale partnerships, both with Huggies and some local retailers in St. Louis. And then when they get to our warehouse, which we just moved into, it's so exciting and new and fancy. It's 20,000 square feet, which actually makes the St. Louis Area Diaper Bank by square footage the largest diaper bank in the country, which I'm sorry is just a total shameless brag that I have to put out there. Once the diapers get to our warehouse, we take them out of their retail packaging and wrap them into packs of 25. Every child who gets diapers from the diaper bank gets 50 diapers a month, which if you've ever been around a kid, you definitely know that's not enough diapers to get somebody through the month. But the majority of families who are experiencing diaper need report that they're going without diapers between 5 to 10 days a month, like when the money from one paycheck runs out before the next paycheck comes in. So for the vast majority of families that we're serving, we're sort of attempting to fill this diaper gap, so to speak. inside that package of diapers, we put also a little tip for turning diaper time into a bonding time between a caregiver and the child. We know that a receptive and caring relationship between a caregiver and a child is one of the most important protective factors against toxic stress and improves child health outcomes and parental health outcomes. And then on the back of that little tip sheet, we also have our volunteers write handwritten, we call them love notes, to the parents who will open those packages of diapers, really just affirmations that there are people in the community who love the parents and caregivers who are opening that package of diapers and who are constantly thinking about their well-being and concerned about what's going on with them and their kids. So our message is really that they're not in it alone. And then we have four partner agencies who get diapers from us every month. So the Diaper Bank in St. Louis does not distribute diapers directly to individuals. We work with partner agencies that run the gamut from food pantries to kind of comprehensive case management programs and home visitation programs, which are proven to improve health and financial outcomes for low-income families. Programs like Parents as Teachers, Nurse Family Partnership, Healthy Families USA, things like that. So our partners get our diapers and then distribute them to their clients. So that's kind of from start to finish.
Wow, that is a lot of logistics at once. And I want to just lift up and say that I'm blown away by the notes and acknowledging the humanity of the parents and encouraging them. This is true reproductive justice work, and I'm thrilled that we have you on the line tonight. So my next question for you is turning to those of us on the line who are listening now and those who will be watching in the future from the recording. How can people best support diaper banks in their community? And if there isn't one, how can they bring a diaper bank into their community?
Awesome. Yes. So, I mean, I think just speaking from the experience of our diaper bank, we send out 166,000 diapers from our diaper bank warehouse every single month. So we need volunteers all the time, and I think there probably isn't a diaper bank in the country that doesn't need volunteers to help them do things like that. We send out 4,500 of those little handwritten love notes every month. So we also need volunteers to do that. And, you know, diaper banks just need help with spreading the word that they're there. I think every year the National Diaper Bank Network engages in a survey in collaboration with Huggies, asking people in communities about their experience of diaper need, but then also asking about their awareness about programs that provide diapers in their community. And I know that in St. Louis and around the country, there is a disconnect between the hard work of diaper banks and the awareness of families and communities who are in of assistance with diapers. You know, diaper banks are, I think, almost all. At this point, there are 300 diaper banks around the country that are members of the National Diaper Bank Network, and the vast majority of them are still led by their founders. This is a very young movement, and, you know, it's just, I mean, we've been around for 5 years in St. Louis, and I feel like every time I try to tell somebody what I do, they're like, I'm sorry, what now? What did you say? I'm like, diaper, yes, like baby diaper. So I think awareness is another key piece. But then also, you know, just spreading the word that this is a reality for so many parents. You know, we've made an intentional choice to partner with home visiting programs, which I said are proven through research over decades to improve outcomes for low-income families. And we do that because we know that that is a place where a family's not just going to get a diaper, but they're going to get support with all sorts of other things. And I think for folks to help spread this message that, like, the system, quote unquote, expects a lot of low-income families. You know, it expects families to become financially independent or to become sober or to work on getting a better job or to work on that education or whatever. And my challenge to to folks in our community is, how can we possibly expect families, mothers, fathers, to do that when every day when they come home, they're coming home to a house that may not have toilet paper, that doesn't have diapers, where the women in the home don't have access to period products? Like, how can you achieve bigger things if these baseline physiological health and safety needs are not met? And that is the message I think that diaper banks benefit the most from folks sharing.
Absolutely. I want to shift gears about something, the exciting new initiative of providing support for periods. And specifically, as we know, menstruation doesn't stop or obey the dictates of what someone has in their wallet. So I just think it's fabulous that the St. Louis Alliance for Period Supplies is a new venture of the Diaper Bank. So can you tell us how that idea came about?
Yes. So we were in contact and kind of collaboration with a researcher here in St. Louis, Dr. Nancy Burt-Coleman, who's done really groundbreaking and incredibly, unique research here in St. Louis, like really the first ever look at whether or not women in the United States have access to menstrual hygiene products. There are literally zillions of studies about whether or not women in the developing world have access to menstrual products and what those effects look like. But Anne, who has worked in Ethiopia around menstrual equity, decided, like, hey, maybe we should find out what this looks like in St. Louis. And she found, shockingly, and this is in the description of your webinar, that 64% of the low-income women in her survey in St. Louis like routinely lack access to menstrual hygiene products, and 20% of those women literally never have access to menstrual hygiene products. So right around the time that Anne was releasing her needs assessment results about the situation here in St. Louis, the National Diaper Bank Network reached out to us saying that they were in the process of launching the National Alliance for Period Supplies, which is sponsored by You by Kotex, the Kimberly Clark brand. Huggies is kind of sister Kimberly Clark brand. And they were impressed with Anne's research and wanted to know if we would be a pilot partner in this new National Alliance for Period Supplies. We obviously said yes. And so we actually received a big donation of 200,000 pads and panty liners from You by Kotex last year. And now that we're in our new big warehouse, we have kind of started to talk really casually in St. Louis about the Alliance and our work to begin to address period poverty, have had 200,000 more pads, tampons, and panty liners donated from individual people in the community. It was a little bit difficult, I think, for some of the folks on our board and on our team to wrap their heads around, like, hey, wait a second, what a diaper bank, what do period products have to do? And our first, reaction was really that the health of a mother and the health of her child are inextricably linked. And if a mother has diapers for her child but doesn't have period products for herself, then she's facing some of those same barriers to attendance at school or work. But then over the past year, our understanding of the importance of this issue has really evolved in our understanding of the role that the diaper bank wants to play in addressing basic hygiene needs and lack of access to basic hygiene needs in the St. Louis region. So we really now are reshaping our understanding of our own mission to providing access to products and services that we say foster dignity and full participation in life. Again, back to what I said before, if you don't have toilet paper, if you don't have diapers, if you don't have period products, but you're trying to work on your education, or you're trying to work on getting clean, or you're trying to work on getting a better job, like, there is something dehumanizing about knowing that even though you're working so hard on these other things, that you cannot meet the basic needs of your own body and your child's body. That is distressing, and it's an affront to a person's dignity in a very intimate way. And so we recognize that, like, our role in this St. Louis nonprofit landscape is to support those programs that are helping people reach those higher heights by making sure that the programs who are helping folks, get a leg up have actually the products that folks need to have just like baseline security and health needs met. So that's kind of how this evolved. And we're so excited.
Thank you for the work that you are doing to ensure the dignity of families in St. Louis and people in St. Louis. It is truly inspiring. I want to encourage folks, we're going to actually if folks have questions for Jessica, I want to encourage anyone on the line to just put them into the chat box. We'd like to do questions with her while she's still on the line right now. So I'll ask Jessica one more question, and then we'll move to any questions from the audience. If you could just say for me a little more, as you know, around 85,000 people have been dropped from Medicaid in Missouri just in the last year. How do you see the connection between the financial challenges that families are facing and their access to health care?
We don't, so I already said that we don't work directly with low-income families, but the partners that we work with, I was actually just in a meeting recently with a pediatric clinic at Cardinal Glennon Hospital in St. Louis. They receive our diapers and they're about to start getting period products, and they were talking about some of the social determinants of health that impact their clients' lives. And the number one thing that was impacting their clients was a lack of access to transportation. Okay, so people have trouble getting around in the world, right? People also have trouble affording all the things. When families lack access to basic health care, like when families are denied access to health care, they're just like, I mean, that's just another, I think, as a person whose kids have been on Medicaid, sorry, not Medicare, Medicaid, it's already a rigmarole, right, to get your family enrolled in a public benefit program. And it is a system that is designed, I think, to make you have to work really hard to get things that really you're entitled to get. The second thing that I want to kind of add to this, like, contextual picture is that, like, more than 50% of the families who receive our diapers telling us that they are raising more than 2 children with an income of less than $1,000 a month. And like, I know people are on this call from all over the country, at least I think so. But here in St. Louis, market rate rent for a 1-bedroom apartment is like $600 to $700. So if you think about trying to use $300 to provide for your family's health care, if you don't have health insurance, transportation needs, clothing, food, utilities, all of the other things that aren't rent, I mean, it is just literally impossible for a family to survive. And I guess I can probably get political, Pamela, but we're on the same line, so I don't know. But like, I think the thing about that is that I am concerned and troubled that our political leaders don't seem yet to understand that the strength of families and the strength of the most vulnerable families in our communities is integral to the strength of our whole society, right? And that it is foolish to think that we can abandon parents and children and expect that they will be able to do well. And so I honestly don't know how our families are doing it, even when their kids have access to Medicaid. And I cannot imagine the burden of knowing that not only can you not provide diapers, but now you can't even take your kid to the doctor. I can't imagine what that feels like as a parent.
It's a total violation of people's human rights in the United States. And I thank you for that. I have one question from the audience for you, and then we're going to pass on to our next presenter. But Jessica, this is an interesting question coming from Brittany. The question is, how effective, if at all, would it be to distribute reusable diapers?
Yeah, so that is actually a conversation that we are engaged in. So, you know, for a long time, we've sort of taken this position, and, you know, I've been in the position as a mom who has experienced diaper needs. So our organization has sort of adopted this position that is pretty common, that, you know what, poverty is really stressful, and that is the truth. And I think for us to ask low-income moms to wash dirty diapers when we don't have any idea what their access to washing machines is, when we don't have any idea what their access to reliable transportation is. I say all the time, I have 5 kids. My youngest daughter is 3, and we use cloth diapers with her. And I didn't like carrying that stack of dirty, stinky diapers from her bedroom to our laundry room, which was maybe, I don't know, 100 feet from each other. And I cannot imagine what that would be like to try to take a bag of dirty diapers on the bus to a laundromat to wash them. Not to mention the fact that we were doing laundry, I felt like constantly to wash those cloth diapers. But more recently, we've been trying to actually partner with an organization here in St. Louis, and a national cloth diaper manufacturer, Cotton Babies, that's based in St. Louis. They actually have a cloth diaper loan program, and we are learning that some of the families that we serve who do have access to laundry, but also, families from, I don't know, there are definitely families out there who would love to know about reusable and washable cloth diapers. And we haven't yet provided that, but we are in the process of making that connection available to a cloth diaper loan program called Share the Love through Cotton Babies here in St. Louis. So it's a great question.
Thank you. All right. Well, thank you so much, Jessica. This has been wonderful. I'm going to ask that you now hang up your phone because Pamela may use hers to dial out to another panelist. We really thank you for joining us. Thank you.
Thank you so much.
Okay, great. All right, so I will pass it back to Pamela to introduce Paula.
Thank you so much, Erin. So it is a pleasure to introduce Paula Kenny. Paula is a University of San Francisco School of Law alum and former Women's Law Association president. Currently, she is a premier criminal defense attorney where she appears in both state and federal matters. As a recent article stated, Paula is no stranger to social justice issues. She is active with the San Mateo County Drug Court team and has worked for years raising awareness that drug abuse is wrongly characterized as a criminal law problem. She was the first attorney to gain an acquittal in a 3-strikes case in the state of California. Bravo. In addition to her legal work, she assists an organization that works with rural families in Nepal to help prevent their daughters from being trafficked into brothels. So please, thank you so much for joining us, Paula.
Thank you.
Fantastic. So I have to confess that I first read about your activism in an article in Mother Jones that was titled, "Jail is a Terrible Place to Have a Period. One woman is on a crusade to make it better." And we're going to make sure that we send that out to the list when we send out the recording of this webinar, because it's a must read.
It's a good article. It's a really good article.
Awesome. Yeah, so if you could please just tell folks who aren't familiar with the article, if you could tell us about how you became aware of the issue of the cost gouging for period supplies in jails and prisons, and what has happened since the article came out in February.
Okay, so really this whole issue is an example of, it's not what I don't know that gets me in trouble, it's what I think I know. So I've practiced criminal defense, state court criminal defense for decades, and I've also done jail conditions cases for decades. And in the course of this time, I had assumed that county jails made menstruation products freely available to women inmates. And that's just wrong. So I thought that it was that way because the federal government in 2017 made a regulation with the State Department or with the Federal Bureau of Prisons that all women inmates should have menstruation products made freely available to them at their choice. So a federal prison inmate has the right to get a tampon or a pad or a panty liner at their choice upon request. And in the state of California, the state prison system, the same is true. And so what happened is in February of 2018, like a year and a couple months ago, I was in the San Mateo County Jail visiting a woman who was in custody. She was on a suicide watch, so it means that your clothes are taken from you and you're given what's called a Ferguson, named after, I think, the guy that invented this thing, which is like this super heavy Velcro attaching, like quilting thing. So you can't use this material to hang yourself, okay? So they take your clothes when you're on a suicide watch because they're concerned that you're going to hang yourself or some such thing. And so I saw this girl and she was crying. And jail, you know, sucks no matter what, even if you've done a bad thing. I mean, it's horrible in my opinion. So she's super tearful and I'm like, what's up? And are you not really trying to hurt yourself? Because one of the ways that people can be shamed is to be put on a suicide watch when they're not really suicidal, because it means your clothes are taken and you're put in this horrible little outfit. And so she was tearful and stuff, and she's like, oh, I've got my period. And I said, well, that sucks. Periods suck. And she's like, I don't have any money. And I said, well, I know that because you're in custody, because if people had money, they can generally post bail. But she was, you know, as I said, super tearful. And she's like, well, I have my period and the sanitary napkin doesn't work on the paper underwear. And I'm like, what? And she had menstrual blood coming down her leg. And I was like, this is ridiculous. This is 2018 in California in a Bay Area county, which is supposedly a progressive area. So I called the jail commander and stuff and people, and I got her tampons right away. And then I did a Public Record Act request. So every state in the United States has some state law requiring the government to give information to its citizenry upon written request. And so I asked for what the San Mateo County Jail menstruation product provision policy was. And so and for whatever reason, I just thought, oh, I better ask for the commissary list too. So the policy was that they would provide sanitary napkins to women. And then the commissary list showed that they charged $6.99 for a box of 10 tampons. And that's insane because it's 69 cents a tampon. I mean, so if you had the foresight to order your tampons during that, you know, because how commissary works, you make your order once a week and then it comes a couple days later. So you're supposed to change a tampon, I don't know, every 4 to 8 hours. So let's say you would go through a box of tampons in basically 2.5 days. You can get your period from 3 to 7 days. So anyway, my point is you would spend, you know, $12 a month on menstruation product in that jail, when in reality it should cost you less than $4. But so I said, that's just crazy. So I wrote him a letter and made some phone calls and said, I'm going to sue you if you don't make menstruation products freely available to women at their choice. And I had recently sued them for another thing, building a jail that didn't have soundproof attorney rooms. So they knew I would do it. And so they agreed to freely provide menstruation products to women inmates. And it was really sort of fun in a twisted way. I mean, my sense of fun, anybody that does state court criminal defense gets sort of a twisted sense of fun. But I would see the women in the holding cells and I would say, are you all getting your menstruation products for free? And they're like, yes. And so one person said something to another. And so for a couple weeks while this change was being implemented and everybody was finally getting menstruation products without stressing about how they're going to pay for a tampon, I'd go into the holding cell and the women would be like, oh, here comes the tampon lawyer. And so I thought that was pretty cool. I mean, of all the things to get a funny thing about to be the tampon lawyer, it is hilarious. So then what happened?
I love it.
I do too.
I mean, you should get a T-shirt. You should get a T-shirt with the tampon lawyer on it.
Oh no, some of my friends have made these pink shirts with, you know, red blots all over them saying, you know, tampon lawyer, tampons for justice, and then, you know, all that kind of stuff. But so what I did then was I did a Public Records Act request for every county in the state in California. So there are 58 counties, so I did 57 Public Records Act requests since I'd already dealt with San Mateo. And I got these crazy policy back. I mean, some wouldn't give them to me. Some said it was protected. Some say, and it just was super annoying. Some of the policies said the sheriff would provide for the special needs of women. And I would write back, there's nothing special about a period. You know, this is just ridiculous. And I also asked for the commissary list because the way that the policies were written, it was hard to tell what they were really doing. But then when you got a look at the commissary list, then you could tell that they were charging for tampons. And so no county ever charged for sanitary napkins. Out of the 58, the bulk of the counties charged for tampons. San Mateo was the highest at 69 cents, but a lot were at 55 cents, 45 cents, 40 cents, 35 cents, 25 cents a tampon. There's no rhyme or reason, okay, because in the state of California, the county sheriff can set the price of everything that they sell in their commissary store. So you just had some guy saying, oh, I'll charge 50 cents for one tampon. And again, it's crazy because you can't, it's not like you can go to the store at the county jail. You don't get to go to a store at all. You just put in a commissary list and get what you get. And so what happened is as I started to get the Public Records Act responses, I just picked a couple counties that I wanted to sue. Not because I wanted to necessarily sue that county, but there was something in addition about how that county jail operated that was bothersome to me. So first I filed a lawsuit against San Luis Obispo County, and their county council, funny enough, who was a woman, took the position that because there was a state regulation that said the sheriff shall provide tampons and or pads, that gave the sheriff the choice and not the inmate the choice. And so the public outcry was, you know, huge. That's because San Luis Obispo County is a, you know, fairly wealthy county. Oprah Winfrey called it the happiest place on earth. So this happy place on earth isn't very happy for a woman inmate. So the public outcry was pretty big, and so they changed their policy. And then I just talked to sheriffs and talked to people so that they eventually changed the policy. And then eventually I filed this class action lawsuit in Sacramento County, which is the county, the county capital of California's Sacramento. And so that sheriff was charging 25 cents a tampon and sought to change the entity that oversees county jail operations to change the rule to require menstruation products be freely provided. And so that's basically what happened. But it took like over 500 hours worth of work and a ton of time. But it's,
But I want to make sure that we have time for questions, but that was an amazing overview just of how you had to unravel the entire process to make sure that people in jail were given access to menstrual products and that it wasn't out of price range. That's just a horrific situation to be in. If you have a question for Paula, please do drop it in the question tab. I already have one that you sort of answered, but I just want to toss it out there and see if you have anything you want to add. But is there work that people could do in their local communities if they're concerned? I'm assuming if this is a California problem, this is in other areas as well.
Well, that I'm working with the USF, University of San Francisco, law grad named Sheila Templeton, and Sheila and I have been working really hard to try and figure out what it's like in the rest of the United States. So I told you in the federal government, the federal women inmates get free menstruation products. And as it varies from state to state. And within a state, it varies from county jail to county jail. So that's what we're going to try and figure out is how disparate it is. But I mean, if you think about it, I mean, Jessica's presentation about the diaper banks, I mean, maybe there should be similar things for menstruation products, because I mean, poverty isn't something that just lands somebody in jail. Even when people get out of jail, it's such a challenge to get out of custody and then to make these sort of adjustments. So, I mean, having looked at this issue, there are school areas that people have real problems having menstruation products. So we should make it available to them. And then the other thing, I mean, if you think about it's frankly ridiculous that in 2019 I'm even having this conversation with anybody that human dignity could be diminished. And so the other thing is, if you talk about taxing, how on earth can my tampon be taxed and some guy's razor not be taxed? So when you even think about this, 40 out of 50 states tax tampons. So it's way more expensive to be a woman. I don't regulate guys' bodies, but I don't want my menstruation products being taxed. And then even the other thing is that to sort of think about, because it's complicated, 70% of women use tampons. I mean, I think the cost over the course of a woman's lifetime is, a couple $1,000s for menstruation products. And, me, I'm a lawyer. I can afford it. Actually, I don't have my period anymore. I'm so happy. I am so happy because when you think about how many days women menstruate in the course of their life, 3 to 7 days a month for basically 38 to 40 years, that's roughly 2,280 days of having your period. That sucks. That's over 6 years of your life just having a period. I mean, I think we ought to be getting some reward for that, because but for the period, there wouldn't be a guy on this earth. So
true, and that's a strong note to end on. So thank you for that, and for your advocacy and for that wealth of information, which I know our listeners are going to act on very quickly, and hopefully we're all going to wait and see what you and that project at USF come up with, because I think that's gonna spread nationwide. Paula, thank you so much.
Thank you.
And we're gonna switch over to our other panelists right now. Thank you.
Okay, thank you so much.
Hi, Pam.
Hello.
Hello.
There?
I'm here. Can you hear me?
Yes, we got you.
Okay. Hi, Pam.
Hello. So, hold on one second. All right. So, Lori Bertram-Roberts is the co-founder and executive director of the Mississippi Reproductive Freedom Fund, a reproductive justice-centered organization. The Mississippi Reproductive Freedom Fund is the only state-based abortion fund service source in Mississippi. MSRFF provides direct funding for abortion access, as well as practical support, funding emergency contraception and birth control, and provides inclusive community-based sex education while working on broad-based reproductive justice work in intersecting with racial, gender, labor, and youth justice issues. Lori has been protesting, advocating, and engaging in political work and grassroots activism since her teens. She has appeared in many local, national, and international media outlets discussing abortion access, birth justice, LGBTQ, and women's issues in Mississippi. She often writes and speaks about her personal experience as a teen parent, living in poverty, surviving rape, sexual abuse, and domestic violence. Lori, welcome.
Hey.
Hey. So we're
sorry to be late.
I'm okay. How are you?
I made it.
There you go. So full confession, we're a little tight on time, but I definitely am so glad that we have you on the line, because I wanted to hear from you about how distributing diaper services and period supplies is different through an abortion fund. So let's just go ahead and go there. How did you go about setting this up?
Yeah, so I really feel like it's an extension of our work as an abortion fund, right? So a lot of times the same people who we're providing abortion funding for are the same people we're providing period supplies and diaper supplies for. The majority of our callers who need abortion funding are also parents, often parents of small children who need diapers and or disposable training pants or even reusable training pants. And as a low-income Black woman who has a gaggle of children and has been there, done that, it just made sense to have this inclusive programming. Like, we're also in the process of opening a pregnancy and parenting resource center. So like, it's just part of that like broad programming that we're doing. You know, like we have a little free pantry. We also have a little free library. So we also give away diapers and period supplies, right? It's all just connected. We do our stuff a little bit different than the first person who was speaking. Like, we don't get our stuff, unpack it, and then repackage it into 25 diapers. We give people full unopened packages of diapers because a lot of our parents have children in daycare. And if their packages are open, they can't take those to daycare. And so for us, it's a matter of like, you need what you need, and we want to meet you at your need and what's most practical to you. We have some families who we supply literally their whole, like a whole box of diapers to them. There are people who have been referred to us who are on extremely tight budgets, who are either disabled or living on extremely small budgets. Generally people who are on TANF, and in Mississippi for a family of 3, TANF is less than $150 a month. In Mississippi, our TANF approval rate is like less than 2%. So you're talking about people who are, it's very hard to get on TANF here, and then even if you're on it, you don't have that much money. So, you know, so it's a big deal. Like, diaper need is a huge need here, and we just have a diaper closet. Like, we're not even hitting the need, we're just a small drop in the bucket, but we do have a couple other organizations that we partner with, which one is a breastfeeding support group, for low-income women, and we partner with them, and they distribute diapers. And then we also partner with another homeless outreach organization. And then we also have just recently partnered with another activist group that was doing homeless period outreach, and we're kind of like merging our programs to make them more effective.
Got it.
And we already are out doing. Oh, I'll be real quick with this. We're also trying to connect with the 3 schools that are near our property to supply them with period supplies.
Got it. Okay. We have time for just one quick question, and this is a very important one. How do you get your supplies donated, and can people donate directly to you?
Absolutely. So on our website, which is msreprofreedomfund.org/donate, we have several wish lists from Amazon, and there is one specifically for our diaper and period supply closet. Anyone can go on there. You can pick whatever things you want in whatever mixture you want, and they will be shipped directly to us. People can buy things from Target and have them for pickup in Jackson, and we will gladly go pick them up. You can email me. Our email is on that website too. You can email us. I will walk you through whatever a source you want to send us supplies from. That's fine. You can just send us money, and we will go pick those things up ourselves. But we have literally every kind of resource you could possibly think of on there. We do have reusable diapers that we loan folks. We have washable pads that we loan folks.
Awesome.
We give away Diva cups. Literally whatever people want, because we never assume that poor people don't want things, because we're poor people, and my daughter has used the Diva cup since she was 14. So as poor women who have used cloth diapers and have used these products, we don't assume that folks don't want them. A lot of times people want them, but it's out of their reach of accessibility. So we just want to make things accessible to people, and if you want it, we got it. You can have it.
Awesome. So y'all heard it. You just visit their website, and you can actually donate directly to the Mississippi Reproductive Freedom Fund. Lori, thank you. I apologize that we had to come back to this, but I think we hit the major points, and I'm going to hand it really quickly over to Erin to close us out.
Thanks for having me.
Thank you, Lori. You're a total rock star. We love you. And thank you also to Paula and to Jessica for this incredibly inspirational call. So I just want to do an encouragement for everyone on the line tonight to plug into Reproaction campaigns. Sign up for alerts at www.reproaction.org. If you get on our email list, you'll get announcements for these free Act and Learn webinars we do every month. We don't want you to miss a thing. We also do so many direct actions, as well as offer online petitions and ways to take action. You can follow us on social media. We're Reproaction on Facebook, Twitter, and Instagram. And save the date for next month's Act and Learn webinar, which is going to be fantastic. We're going to talk about Human Coalition's anti-abortion fake clinics and how they are a public health disaster. The state of Arizona had a bill proposed this session that would have awarded, stay in your seat, $7.5 million to this fake clinic chain. And they also are trying to get more than $1 million in North Carolina out of public budgets. This is an issue of emergent concern, and we want to make sure that all of you in all your states are ready for what's coming up. So make a plan to join us on Thursday, July 11th at 7 Eastern, and be sure to sign up for our list at reproaction.org, and you'll get that invite when it comes out. So with that, I am going to close out the webinar. Thank you again to Jessica Adams and Paula Canny and Lori Bertram-Roberts for your deep reproductive justice work. And as always, thank you to my fabulous co-director, Pamela Merritt. Good night, y'all.